Hello, everybody, and welcome to the Elad Pod. This week, we've got two wonderful guests, and we've got a bunch of Passover possums to talk about. Our first guest will be Emily Weber. She is running for House District 24 over in the Kansas City area for the Missouri State House of Representatives. We're very excited for her to be on today. And our second guest will be Mikel Whittier, who I have known for a bit. I already yelled at him for us not hanging out more, but he was right. It was totally my fault since social distancing has occurred, and previous to that as well. But he works in the healthcare and healthcare equity space and justice, and is just so involved. And I think he'd be a wonderful resource for you all to get to meet. So we are going to start with Emily. We are going to bring in Mikel, and one, both, or maybe none of them, depending on their experiences today, will choose to hang out and discuss our furriest friend of the quarter competition, which is ongoing right now. So everybody, welcome to the pod. And Emily, welcome to the pod too.
Thank you so much.
Yeah, thanks for coming on. I really appreciate it. And, I know it's always a busy time on the campaign trail. So I thank you so much for being here. How are you doing?
I'm doing well, as expected, I guess.
Yeah.
How are you?
I'm okay. I mean, look, I've gone a little bit crazy, and now we've got a podcast and a TV show. I like to call it a TV show because it makes me feel better about that. Yeah, it's been very interesting for all of you who are out there who are watching. Please go ahead, we are human beings. You can comment. Ask any questions that you might have for me, for Emily, for Mikel, for animals that probably won't respond as well as the rest of us. And your comments should be coming to me. We are testing out some new features right now, so let us know if you're watching and you're there. And if all else fails, I've got another system over here where I can get your comments from too. So that's how we're going to do it today. So basically, I'm doing okay. That's the answer to that question. So let me, I guess, if you could you introduce yourself to everybody so they can get to know you?
Yes, definitely. So thank you for having me on today. I want to say first, I hope everyone is safe and well. And I also want to say to all you pet lovers, happy National Pet Day. So my name is Emily Weber, and I'm running for Missouri House of Representatives for District 24. This is the Midtown downtown area of Kansas City. It's one very amazing district. So this was never a path that I thought I was going to go down. I've always been an activist, but it was actually the day after the 2016 election that made me get more involved with our local political elections. I made the final decision to run because I was worried about the present and future of Missouri.
Yeah. I mean, it's a very good reason to run, because we have some significant issues in our state, and I've talked about this a bit before, and I think even on our last pod we had Betsy Fogel, who's running for House as well in the Springfield area, and a lot of what we're seeing right now, all of the vulnerability that we're seeing in our state didn't just come up overnight. Like, this has been an issue that we've been seeing for years and years and years, and now we're in this situation where we are really struggling to deal with the challenges that we're facing as a state. So
exactly. I mean, these issues, they've always been here. I think it's more aware now than ever to a lot of the folks out there that these issues have always been here, and hopefully when things start coming around and going back to some kind of normalcy, we can start working on a lot of those issues and making Missouri a better state.
Right. Yeah, I totally agree. Is there, I guess, having been campaigning for a bit now, is there an issue that, I know a lot of stuff has changed, but is there an issue that you were just super passionate about that was, really a big driver? Maybe, I know it was probably multiple, but like one that was really, this is what's making me decide, hey, I got to run, I got to go do this. And has that issue or the way that you're looking at it, has it changed at all since the advent, or not the advent, but the implementation of physical distancing?
I mean, Oh God. Okay, so one of the biggest issues that
Right, I know. It's like everything, right? Yeah.
one of the biggest issues that I'm a huge advocate for, and we've been, seeing day after day before the pandemic and now during the pandemic is healthcare.
Mm-hmm.
Healthcare. I mean, healthcare is a huge priority in my campaign. I've been so I'm a graphic designer by trade. I've worked anywhere from small to big companies and freelanced myself. I've gone without health insurance
Mm-hmm.
for a while. I've been in that situation where it's God, do I pay student loans and pay my bills, or do I go to the doctor and hope that it's not going to be a huge bill right now?
Right.
So expanding Medicaid is one of the issues that I've always been a huge advocate on, and the campaign is too. And we are, looking at if we expand Medicaid, a lot of these lower income folks who don't have health care right now could go to the doctor. God forbid they get coronavirus and without health insurance, and what happens? So right now, health insurance, healthcare, it's number one priority, and I feel like it's number one priority still at this
Right.
point.
Right. Yeah. I mean, that's if you don't have insurance, and I know that the federal government has announced, different programs to cover all of this stuff in case you do get sick and you're uninsured. But the problem is, like, if you don't have insurance, you're not used to having insurance, then you just are used to not going to the doctor. I mean, I was uninsured for a little bit there too. And I still don't really go to the doctor. But there are, that's probably just a problem that I've got. But my wife will tell you that for sure. But there are, it's a whole issue. And I mean, there are a lot of folks who are going and, have been promised, oh, well, you're uninsured and you'll get covered and all this other stuff. But then the bills still come. And, that's all of a sudden, that's like in the news, and then people are seeing that and are like, well, I was promised this and I'm not getting it. And when you're used to having the government and so many of these other public institutions make promises and then never really deliver on them, I mean, that causes a whole bunch of issues in, just the institutional framework, but also in society and how people respond to these situations.
Exactly.
Yeah.
Exactly.
Yeah. So
I'm kind of with you with that one on the health insurance too. I should probably go to the doctor a lot more than what I do.
Well, yeah, right. I mean, so I used to have it when I worked for the state as an assistant attorney general. I had it, and it was good health care. And then when I left, I was in the Obamacare. I was on the exchange, and the insurance was so expensive for just like nothing. But there was a period before that where I didn't have any insurance at all. And I like to play rugby and football and some other things, and you start asking yourself, is this really a good day for that? Like, you really should be doing that. But I'm doing okay now. But yeah, it's unfortunate, especially when you have a situation where folks, like in our state is providing insurance to state employees, and they certainly deserve it, and they deserve a lot more benefits in our state. We're like the lowest paid public servants in the country. But
Right.
yeah, I mean, if we really should be able to develop some kind of a system to make sure more people can access care. And I think Medicaid expansion is exactly right. I mean, we are leaving money on the table right now as a state when we could be insuring over 200,000 more folks, and that means so much, like access to healthcare, access to mental health, access to substance abuse issues. I mean, all of this stuff, treatment, all of these kinds of things, and we're just not doing that purely for political purposes.
Exactly. And I mean, right now, especially during this pandemic, with stay-at-home order, I mean, we're going to see a lot of more mental health issues going on. A lot of depressions happening right now. A lot of people who are addicted to drugs or alcohol, or just have an addiction problem, they're suffering right now too.
Right.
And then a lot of our rural hospitals, they've closed down. And if we expand Medicaid, it would help open up those rural hospitals.
Right. Yep. And rural hospitals are the ones that right now, if there is an issue. I mean, I had a friend of mine who unfortunately he passed away from the coronavirus, but he initially went to a hospital that wasn't really prepared to deal with that. I mean, a lot of folks were they were diagnosing pneumonia versus the virus at the beginning, but they needed to have emergency medical staff come in and replace everybody who was there because they all had to go into quarantine and they didn't want to give it to other people. They didn't have the measures in place. So there are hospitals now, and I think there was some news pretty recently in Missouri about some of the hospitals that are furloughing folks because they don't have enough funding. Because we've lost. Now we're prioritizing a lot of this treatment, which is very important. But at the same time, a lot of the money for hospitals and healthcare facilities was coming through voluntary surgeries, and we're not really doing those right now. So the funding issue is a very big one, and I know the governor's talked a little bit about it, but certainly not as much as Medicaid expansion would have done before this already to make sure that folks were doing better. But emergency funding definitely seems like something we need, I think, right?
Right. I'm so sorry to hear about your friend.
Yeah. He was, he was a good guy, Al Grimes, and he actually worked quite a bit for the Democratic Party in Missouri. So he was very involved, and he would, talk to, Republicans all the time too. He wasn't one of those, I'm just sticking to my team and, by everybody else. But yeah, I mean, he talked to his state representative a lot, actually tried to get me to talk with him and meet with him a few times over some of the issues we shared. And good guy, a veteran, and he served his country for a long time, and he fought it as hard as he could. But certainly, his memory will certainly be a blessing for all of us, and we really appreciate everything that he did, and send our thoughts to his families and friends and everything else. So, but it's a serious thing. I think there's more and more people. I've got quite a few friends who are now, it's not like, oh, there's some virus going on. It is directly impacting so many people in our country. So, we are not immune from that here in Missouri. So,
exactly.
Yeah. So healthcare is obviously a very big issue. And for folks who are interested, Medicaid expansion looks like it will be on the ballot. They got enough signatures, so that's exciting. That will be something to vote for, and we'll certainly have more information about that. And it sounds like both of us are in agreement. That would be a good thing. So yeah, good. So we've got that. Are there any other, any other issues right now that maybe you're talking to folks? I know in the Kansas City area within your district. What's kind of happening there right now? Are people getting the resources they need? Who's the big folks who are providing resources? What's going on?
Right now, I think so that we did have some free lunches going on, and unfortunately, the volunteers that were doing the free lunches, they did get the coronavirus, so they shut those down.
Yeah.
So what we're seeing now is KCPS. They've stepped up. They are getting those lunches out for any kids that are 18 years and under, from 11 a.m. to noon, Monday through Friday, I believe. It's teachers they're helping. God bless the teachers. They are stepping up and doing above and beyond from what I've been seeing. But they're getting those free lunches out. They set up intersection of East 30th and Home Street, Destiny Life Center, University Academy, Southeast Community Center. I believe you can pick all those up. We're seeing a whole bunch of small businesses and restaurants. They are doing a lot for the community. One of the things, I came from a small rural town in Kansas, is where I was raised.
Yeah.
And one thing that I saw that my parents really taught me and my family was communities, and how, you give back to the community to build the community up. And it's amazing to see during a pandemic how the community has come together and helped everybody. They are there for whatever you need, for just a quick smile or a pick me up, or if you need help with food, grocery run, whatever you need, the community's out there to help you. Yeah. So, Rieger, they're doing a pay as you are able right now. They've switched completely. You can donate to them. There's a list. There's a whole bunch of food pantries that are trying to help as many people as possible with food necessities. And then, harvesters are always out there too.
Yeah. Yeah, that's I mean, it's really important. So I've been teaching for a while through a nonprofit that I started in St. Louis, and one of the biggest services that we provided for kids and families was the meal program. And yeah, I mean, we've had some of those issues here in St. Louis where folks who were distributing the meals caught the virus, and you can't have them then distributing the kids and families because that's going to spread. We actually had someone pass away who was involved in that. And, I mean, that's, again, back to the healthcare system and everything that we're seeing. But, yeah, it's certainly a very big issue right now. We're seeing, and Freddie, who has been a great friend of mine and has worked in the campaign, we were talking the other day, and he said, we really need to talk more about what our public institutions really provide in all of our communities and the importance of them, from libraries to schools and all these things, because you don't really, unless you're working in them, you don't really realize all the different services they really do provide to the community until we start to miss them, and so I'm sure we're all seeing that right now all over the state.
I mean, especially in education, the multiple hats that a person has to wear.
Right.
It's anything from counselor to just support system, providing food, library, anything. It's more than just education. It goes deeper. And
right.
So right now, we're seeing that. Teachers, they should be valued more than what they are right now.
Yeah, absolutely. Goodness gracious. Yeah, I mean, we've asked, and it's so many of like our public servants to do so much more than what they signed up for. From just like you said, like counts all of these things that you said about what's happening in the classroom. We're asking first responders to do a whole bunch. Responding to things that mental health folks should be doing. We don't fund mental health in the state. It's just like a whole, here we are, right? It's like,
right.
You want to be prepared for these situations, and we're all busy, and we're getting busier, and there's a lot of questions around, labor and everything else, and where we are right now in America, and how much time we're spending on this, that, or the other. But we entrust folks to represent us in this representative system. And when we come to a point, you got to trust them to do the right thing and to get us set up the right way. And then here we are, and we're facing a big stress and a big issue, and we're seeing that, maybe that service hasn't been so great for a while, which is why we need really good people to be in our legislature, which is why I'm very excited that you're on the show right now, so I can introduce you to so many people. Hey, this is why right there. So, what, have you thought about, after the election's over, after you've won, obviously, right? What do you, I guess, what's your plan? Like, how do you want to interact with folks? How do you want to run your office? Have you thought about like what kind of attitude you would take to the job?
Yeah, definitely. No, I've 100% thought about that, and of course, at Judy Morgan, and and talked about what it's like in Jefferson City, because District 24, it's a progressive district. It's a great district. We vote. I think it's 90% of the voters are Democrats. So this is a great district. It's a strong Democrat district. I understand going down to Jefferson City, it's not like that, and I do understand that. Missouri is not all Kansas City. There are a whole bunch of rural spots and rural areas that we have to take into consideration.
Right.
I grew up in rural Kansas. I basically, we didn't live on a farm, but we had a farm, and I grew up around dairy cows and everything. So I'm used to rural areas. I've thought about, going down to Jefferson City if I win. And number one is building relationships with the other state reps. And that means across the aisle too. And that means trying to build that relationship. And hopefully we can understand, Kansas City and St. Louis and Columbia, yes, we're more city, we're more progressive. And we need to have conversations on certain issues where we can come to an agreement. It will, like Medicaid expansion, it's suited for everybody. this is something we need to talk about in building those relationships and talking over issues.
Right.
Hopefully getting some things done.
Right. Yes, that would be great. That sounds wonderful. Yeah, I think it's like, the first time. I've been doing a lot of work around the state for even years before I was running for anything. And the first visit I made, it was in Dexter, Missouri, and then the second one was in Caruthersville. Caruthersville's in the Boot Heel. I remember folks, I asked, okay, can we all put on like this little whiteboard thing? What issues are you seeing in your community? And we gave everybody 5 minutes or whatever. It was quiet, and then we presented. And so I was writing them down. And the first issue was, well, we have a problem with vacant properties. And I'm like, well, what do you mean? It's like, well, we've got a lot of folks who, they used to live here and then they moved out because they're trying to go to a better school for their kids or whatever it might be. And that was a big issue, that folks were then leaving their properties. They were kind of collapsing. They were bringing property values down. And so it was hurting everybody else in the community. I'm like, okay, what else? Well, another thing is we have poor kids who unfortunately are trapped going to poor schools and they don't have the resources they need, which connects to issue number one. I'm like, okay. What else? So, well, we have a Walmart here, and it's using another county to get tax incentives, and then it's pushing everybody down. They're all competing, and then the Walmart moved anyway. Everybody lost their jobs. We don't have much public transportation. And I sit there, and I'm like, I drove 3 hours to hear the exact same issues I'm hearing in St. Louis, right? And I think there are certainly issues that are particular to some areas of Missouri versus others, and oftentimes it's due to like local regulations and what's been there. I would think about CAFOs, for example, would be one, and for those who don't know, the farming operations where they concentrate a bunch of animals into, and it creates a lot of pollution. But yeah, I think that there's just a lot that we share, and I think that because our political system has been one where oftentimes we're very much trying to be at odds with each other versus like what you're describing, it's been one where those divisions have been exacerbated versus the commonalities. Does that make any sense?
No, that makes perfect sense.
Okay, good. I try every once in a while. You never know. Yeah, but I think you having that experience growing up, is a really important connection point for people all over the state. And I think the more that we can reach out, to people who maybe don't agree or don't have the same background as us, I think we start to meet each other, we get familiar with each other, and we can really work together a lot better. At least that's been my experience.
Exactly. And I feel like that's what we need to, especially, next year, it's going to be crucial that we work together to get some things done.
Yeah.
So as long as we can start building those relationships and working together, I feel like we all want to make Missouri a better place. So let's work together to make Missouri a better place.
Yeah. Okay, great. I'm down with that. I'm absolutely down. All right, let me see if we're getting any comments in. Okay, Bridget Sanderson says hello to you. She's very excited. Lots of exclamation points there. Yeah, okay. So oh, my friends. So Robin has given a shout out to Tina because Tina is making masks at home. And I know so many people are doing that right now, which is so helpful. And then Tina came on to respond, and she's like, yes, we are very much afraid because of the issues that you were talking about regarding healthcare and the fact that rural hospitals do not have the support that they need right now. It's tough. I'm assuming, because I'm unfortunately, I can't I used to travel a whole lot, believe it or not. It wasn't just on this computer, but I used to go all over the place, and I got to, see what was going on. I feel like the physical distancing for me has really impacted like what I know is happening around the state. In Kansas City, I know we've got a page up right now on the website. If you go to it, it's eladgross.org/COVID. And if you go there, there are 8 organizations that we donated to. And one of them, there's like this joint grouping in Kansas City, like a big effort to get funding to the right places. And that was something that was recommended to me by a friend over there. But I'm wondering, folks they're making masks and they're doing this stuff. Folks are volunteering in Kansas City, right?
Yes. Oh my God. Kansas City. I mean, it's going. I don't want to say it's going great because
Yeah.
it's the people, the community have flipped, and there's so many different Facebook groups that came together and to help people who lost their jobs or they're just looking for more information on what's going on, or maybe they're having issues applying for unemployment, things like that. People are coming together. The masks. Oh my, the people that are sewing the masks right now are absolutely amazing.
Yeah.
I've been seeing endless photos and comments and tweets about people that, they're literally sewing masks for 10 hours a day.
Right.
Trying to fill quotas. And you talk to the healthcare workers and they would tell you, never in a million years would I ever think that we would ask people to make us masks because we have a shortage. Yeah. And this is what it's come down to.
Yeah.
So yes, I'm very grateful for, everybody in the community that has been stepping up. And just like you, I campaigned early on and I've been to all the events, functions, meet and greets, anything that was anywhere. I was usually there trying to meet constituents or just meet the people and get to know like what issues that they've been faced with. And our campaign had to very quickly flip and do a 180, just like most campaigns, and go from in person to digital and virtual. And I'm very happy that our campaign was able to do it as quickly as possible and switch from door knocking to phone banking and, still trying to get out there and touch with the community too.
Yeah. Yeah. Someone was, while you were talking, they just commented that my car is getting a good rest right now. So I guess, there's something to it. But a lot of folks, they haven't been driving for a bit. And that's certainly something that's happening nationally right now. Unfortunately, Jimmy, my car has broken down. Now that it doesn't drive all over the state, it's not working. So,
oh no!
Yeah, it wasn't used to this new life. It wasn't used to this at all. So yeah, I think
I do miss your change your oil video.
Oh yeah, I did. I actually okay. I'm gonna let you know. So I made one more video of that because I changed the oil as the stuff was happening. I think I did it more for me because I knew I wasn't going to be doing it or needing it so much. So I did one, and I usually make a video out of it and I put it online. I was so sad when I made that video. I just couldn't. I couldn't put it. I couldn't. I was like, this is too depressing. I still have it. Maybe I need to put it up in like the bonus content now. Yeah, maybe I should. It was the last one I did for a while, so we'll remember. We'll remember that one. All right, let's get serious here. Let's get super serious.
Okay.
Have you been following the Furry Friday competition this quarter?
Oh, I have.
You have?
I have.
Oh wow, that's great. Do you have
a favorite? Do
you have a favorite?
I've got a few. I don't know. I'm gonna have to go back and look at them again.
That's okay. That's fair. That's fair. We will do an update. Don't worry, everybody. We will do an update at the end of the show about where everything is. There are some neck and neck races, and there are some that have just pulled away. And there's the next round will start tomorrow. So we will see who makes it to the final four after tonight. Do you have a furry friend of your own?
I do. I have two. Mac and Eleanor. They are rescue dogs. Okay. Very spoiled. A little too spoiled. Not my fault. And I volunteered, which I unfortunately had to quit due to the campaign. Time constraints.
Right.
But I volunteered for animal rescues. So I volunteered for Missouri Pit Bull Rescue for years. And I was doing fundraising events and shelter shifts, social media for them, graphic design too. Yeah. So yeah.
Oh, that's great. Yeah, pit bulls are a favorite of mine, and unfortunately, they're so misunderstood in the world. But they're sweet.
Very
well. I've got then. You know what? I got another hard hitting question for you. Why haven't you submitted your furry friends for Furry Friend Friday?
That's a good question.
It's a great question. Thank you. We tried to bring the hard ones on the Elad Pod every time. So yeah, they're very welcome. I just want you to know.
I'm gonna have to submit.
Yeah. They're very welcome. Anybody can submit at our email. I'll put that in the comments now too. Yeah, they're always welcome. The more the merrier.
All right.
We've got a series of possums that will be entered in for this quarter. So good luck. Maybe this won't be the quarter to enter. I don't know. But
I'll wait till after the possums.
yes, the Passover possums. We'll get to them too later. Don't you all worry. All right, let me see who we've got over here, if there's anything left. And folks, you can put these comments in, and any questions you've got, we can always go back to them, and so we can answer them offline too. And if you do have any, go ahead and post them. And I'm going to make sure to post your website over here on Facebook too for everybody who's watching. Everybody else who's watching, you should be able to see that in the description already. So if you can't, let me know. We'll get it to you. Okay. Let me ask you this. What is the best way that folks can get involved with your campaign? Let's say they watch this and they're like, oh, she's got 3 friends.
Awesome.
She sounds really cool. She's got my issues. Where should they go?
They should go to the website, emilyformissouri.com. You can sign up to volunteer there, or just look over the website and see what other issues are important to us. You can also follow me on social media, Emily4MO, Twitter, Instagram, Facebook. You can also reach me by phone. I'll give you the number. It's 816-281-8696.
Oh, I love when they give the number. I love it. Yes. Awesome.
So feel free, text, call, leave a message if you do call and I don't answer, so I know who you are.
Right?
Number one, you can email me, info@emilyformissouri.com.
Okay.
And then also we have a day, it's a digital day of action coming up. So it is next Saturday.
Okay.
Yeah, Saturday.
Okay.
Yeah, next Saturday at 11. It's going to be a rally. I'll give you an update about the campaign, and then we're going to give you phone lists, and you're going to phone bank. And our goal is to hit 1,000 voters in one day.
Wow.
So if you're interested in phone banking with us, please sign up for Saturday.
Awesome. Okay. And can they find? I guess we'll put links to all of this stuff in there so folks can find it. I'm assuming you'll be posting social media, all of that. They'll be able to find it too.
Definitely. And I'll go in the links to or the event or live stream, and I'll post a link to it also.
Awesome. Great. Okay. Well, good. Like, there are all these ways to get involved. I really appreciate you coming on the Elad Pod. This is our 4th episode, so it's really nice when people kind of jump like, oh, yeah, I'll definitely do that. So we really appreciate it. And, best of luck, and we'll certainly get all those links out. And, you can give us some updates. Let us know how things are going, as always, because we kind of talk already. But, let me know how we can help, if there's anything that we can do.
Awesome. Thank you so much.
Yeah, thank you. Thanks for coming. Okay, great.
Definitely.
All right, we will see you later. All righty. All right. Well, that was Emily Weber. She is running for District 24, the fighting 24th in the Missouri State House. We are very excited. We're going to bring on a second special guest now, and let's see if he's over there, because I'm supposed to press this button, and it's supposed to go right to him. So let us find out if I've got him on here. Michael, are you here? Oh, he is, but he's still muted, I think. Do you have the unmute button? Because his face is really, it's a great face. And, the lips are wonderful. They're moving. And he's trying really hard, everybody. I'll tell you what. Yes, he is. Look at that. So you can see how, well, until he gets here, Michael is absolutely wonderful. I met him, a while ago. I think it was through Michael Butler, actually, is where we met, who used to be a state representative. He's now the recorder of deeds for St. Louis City. And Michael Whittier has been working very hard on issues around healthcare, equity, justice. Recently co-authored an article, an op-ed in the Missouri Times about healthcare in our prison system too. So I'm really excited to have him on. Mostly, though, I'm just stalling for him to figure out how to unmute his video. And he did it.
There it is.
Wow, look at that. See, look, I'm getting really good at the stalling thing. It's not too bad. It's pretty solid. How are you doing, sir?
I'm doing good. I'm
Yeah?
doing good.
Good.
It's good to see you. You mentioned at the beginning of the show we didn't hang out, and
I know.
yes, I
Me too.
blamed you,
My fault.
but that was also you twisting my leg to come on the live pod.
That's true. I did. That's true. That's true. I was harassing you. I want to say this. Michael offered, like, I asked him, like, oh, you'd be a great special guest. And he's like, oh, I'd be happy to come on. And yeah, anytime. Well, I asked him this morning if this week would be good. So he did this very quickly. So don't give him any bad news. If you're on the comments or anything, don't do that because he has certainly earned having his mic screw up for a little bit there. So don't worry about it. Well, do you want to can you introduce yourself to everybody here today? Let them know who you are, what you're doing, and why in the world we should listen to you.
Certainly,
I'm telling you.
certainly. My name is Michael Whittier. Thank you for the introduction, Elad. I work for St. Louis Integrated Health Network. We're a healthcare intermediary in the St. Louis region that focuses on access to care for the medically underserved through our collaborations with our federally qualified health centers and community health centers, our hospitals, medical schools, and our other social service providers and the city and county health departments. So we work really hard to really drive equity in healthcare with really focusing on health equity as a vehicle to achieve racial equity as well within the healthcare service delivery. What we see now with the pandemic, but also what Emily mentioned with the health disparities and healthcare access, that's something we do day to day to really advocate on the behalf of community members and our patients throughout not only the St. Louis region, but the state. What I specifically do is I have the opportunity and honor to serve as the strategist of justice and health equity, where I work with the regional criminal justice system to achieve health equity in that system as well. And so we know all of the issues that exist within our criminal justice system throughout the state and our issues with our local criminal justice system in St. Louis. We have worked really hard with the prosecuting attorneys, judges, the jails, social service providers, and many other of our other partners to achieve infrastructure and develop out resources that can really achieve access to equitable quality care for our justice involved population.
Yeah, it's very important work. Having been involved in that for quite some time on the legal side of things as an attorney. First, as I guess even with the Attorney General's office, especially the Attorney General's office has a lot of involvement in with the Department of Corrections, and can give a lot of guidance there because they're the attorney for the state. So when there are issues, which oftentimes lead to lawsuits, we really need to be a lot more proactive on a lot of these different issues. So I'm very thankful for the work that you're doing because it's very important on the from just a basic moral fairness standpoint. And then, on this other side of, we talk about rehabilitation and trying to, folks eventually, when they go to prison or jail, they're going to come out at some point, most people, right? And so making sure that people are coming out and are situated in a way where, they can help and they can live very productive lives and very fulfilling lives versus kind of just saying, well, you're in the system, you're being punished, and you're done, and then they come back out and we expect everything to be fine. It's certainly services like the ones that you're providing are very important to reform all of that, especially that mindset too.
Yes, certainly. And unfortunately, a lot of the things that are put in place are contradictory to one another when you think of them from a policy perspective. So you mentioned the op-ed in the Missouri Times, Liza Weiss, and the work that she's doing at Missouri Appleseed and advocating for our individuals in prisons. She has been doing a fantastic job. But looking at Medicaid suspension as an example, we terminate Medicaid when people are incarcerated. Medicaid is one of the most difficult things to get on in the state of Missouri. Yet when people are released, we're asking them to continue at least some resemblance of quality of care that they have received in prison. And sometimes that is the best quality of care they've ever received, if not the only care they've received. And we have poured billions of dollars into the fight against the opioid epidemic. We have poured resources into housing, all these other things. Yet we know for a fact that people who are coming home are at highest levels of risk for adverse health outcomes and adverse other outcomes that are detrimental to not only themselves, but communities. And so we have to not work against ourselves, and that has significant cost implications, that has significant consequences for just people's well-being and their quality of life. So we have to think about pragmatic solutions through policies, through allocating funding that could really drive wellness, not only for our justice-involved community, but for our communities more broadly.
Yeah, absolutely. So you mentioned Medicaid suspension. And I think that that's actually what you recently wrote this op-ed about. Could you explain more about like why did you decide to write that? And I guess for folks who are a little bit less familiar, could you explain like the process and what folks are going through right now in the prison system?
Certainly. So Medicaid is extremely difficult to get on, as I mentioned. If you're a single mom of two, you have to make less than, I believe, about $391 a month to qualify for Medicaid. And that's not a week, a month. And so if you are incarcerated, you lose that coverage. And that process to get on Medicaid takes weeks, months. It's an extraneous, very difficult process to get covered. And when you look at our incarceration rates, women, in using this example in particular, are increasingly going to prison at a higher rate in Missouri. That is fact. And so when they're incarcerated, they lose that coverage. It is terminated. CMS recommends that you suspend it. However, Missouri has not taken that recommendation, and we continue to terminate Medicaid. When people are released from prison, and using a mother of two, for example, when she's released, she has to reapply. And that is, again, another few months, if not a year plus, to get Medicaid active. And if she's battling with any kind of chronic illnesses, if there's any type of continuity of care needed, it makes it a little bit more challenging when you don't have that coverage. And so you think about the pandemic right now, the lack of access, people not knowing how to pay for things if they do get sick and need to go to the hospital. These are realities that people have been living long before this pandemic. It's going to be a reality long after the pandemic if we don't address access to care for our most vulnerable populations.
Right. Absolutely. We talked about Medicaid expansion with Emily earlier. Have you been involved in that? Are you familiar? I mean, would that have any impact in any of these situations that you're working on right now?
Certainly. So I have a phenomenal team at IHN. Our leadership has been a part of the Healthcare for Missouri campaign in some capacity. And we have really pushed the ballot initiative to make sure that we can have our Missourians vote for whether Medicaid should be expanded or not. I think our leadership in Jeff City have deferred this issue long enough. I don't think it has been really thought through in a pragmatic way. I think political strifes and partisanship has really hindered our progression as a state to really improve our communities. And when you look at healthcare specifically, and when we talk about healthcare as an organization, it's not just that clinical care delivery. It's making sure that we can address social determinants of health as well. And so employment, education, we call ourselves a pro-life state. However, we don't invest in our children once they're born. We look at the Medicaid enrollment or disenrollment figures over the last year or so, and about 60,000 kids have been disenrolled from Medicaid. And you cannot with a straight face say that has been because of a booming economy in Missouri and more Missourians are working, because that is far from the truth. And so getting Medicaid expanded not only increases access to care, but the Washington University report done demonstrates that it addresses health disparities in other states. It has significant cost savings within the first year. But not only that, it's the more
right. Oh, buddy. Hey, can you hear me? Can you still hear me, Michael? I don't think you can. You cut out. Your audio cut out. If you're still there. Can you hear me? I don't think he can hear me either. He cut out. Oh, no. He was on a roll, too. I mean, I'm going to have to text him in a second. Oh, he's back. Okay, good. All right, he's back. Can you say
where did I cut out?
You were just, you were on fire, too. You were just going. I think I'll try to pick up and see if we could tag team a little bit. So yeah, I think, what's happening, because the WashU study is very important. The one that is showing, hey, if we expand Medicaid, it's actually saving the state money. I mean, there might be revenue neutral. That's a possibility. But even then, I mean, you're right. The moral argument is folks should be able to access affordable care. And it's not just, a lot of folks are, well, I don't want my tax money going to somebody else. First of all, look, we all live in a society together. And if this moment is teaching us anything, it's that we are all so interconnected. And Dr. Punch, who I've brought up multiple times on this thing, but she's wonderful and she's very active out there in Missouri, really around the country. Yeah, she's great.
And she's an Integrated Health Network board member.
I didn't know that.
I love Dr. Punch. And if you all listening have the opportunity, she did a fantastic interview on NBC News that discussed racial disparities, access to care. She is just phenomenal. I love her work. She is absolutely amazing.
Yeah, I met her because she took the appendix out of my wife on our first date. So we go back. But yeah, well, I'll have to find that. We'll have to put the link up for that thing too. But it's she's been a very good voice to let folks know we are going to be tested based on how we treat folks who are the most vulnerable. That's what this virus is really testing. And I think you're right. Missouri, leading up to this within the last few months even, had a problem where we were wrongly kicking kids off of Medicaid and making sure they couldn't access care. And then they had to go back and do all this paperwork. But a lot of folks, it's like, oh, well, you can just get back on. No big deal. But the problem is it takes a long time. You're denied care at some point. Usually you find out when you go to the doctor. And now it's like, I got to reschedule and figure out my work schedule. I've got 3 jobs I'm trying to juggle. And a lot of folks, they're done, right? It's just another thing that's happened in my life that's not going to work out. But that's the norm. And the more people that we have like that in Missouri, the more vulnerable people we're creating, the less opportunity people have, and that includes our kids. And if they grow up in that situation, it's tough, and it creates a lot of issues growing up. And I can talk about that forever with education and trauma and all this other stuff. But we really should be looking at all of these policies. How is this going to best serve our kids? And I think that would really solve a lot of the issues that we're seeing right now in our state, in my view. So
I couldn't agree more. And you think about it, if we have a healthier community or state rather, right, we will have a more viable workforce, which that means more tax dollars coming into the state. I just can't comprehend it. It doesn't quite make sense to me. I've been trying to wrap my mind around some of these decisions and really understand how it really betters our communities. And I don't see it. I don't understand it. And one thing that I really do what's something that really gets under my skin is the divide between the rural and urban areas. But when you think about the underlying issues of access, transportation,
Mm-hmm.
long wait times to see a doctor, those are the issues that exist in both communities.
Right.
Yet we work against each other. There's no pragmatic solutions. The Medicaid termination issue, for example. If we suspend Medicaid, that is approximate cost savings of $14 million a year.
Mm.
That could go into improving these systems, reduce the burden of staffing. It could improve efficiency and technologies that allow the systems across the state to work together. There's many ways that money could be used. And however, our inefficiencies, all the red tape are extremely factors in the cost burdens that really drives up costs.
Right.
And we know we need to be finding more efficient ways to manage our budget. The state budget is an issue that nobody has been able to fix for some time. And so we need to figure out the best ways that we can do it. And why not start with investing in Missourians to do that through building healthier communities?
Couldn't have said it better. Isn't it nice when doing the right thing also works out like in all of these different areas, right? from like, being nice to people, having them do well. Oh, the economy's going to do better. It's kind of like, do it, right? So
certainly, and I would be remiss to not mention the efforts to respond to the pandemic that are happening here locally.
Yeah.
You can go to preparestl.com.
Okay.
I am honored again to be a part of a fantastic organization with fantastic partners: the Regional Health Commission, the City County Health Departments, our Community Health Worker Collaborative, Alive and Well, St. Louis Mental Health Board. The Urban League and other partners have really put together this communications campaign to really let communities know what COVID-19 is, how they could prepare themselves, how they can reduce the risk of coming in contact, and the importance of staying home and social distancing. Our teams, our partners have done a fantastic job. Our board members, regional leadership has done a great job in trying to reduce the curve. Articles have just been written that's mentioned St. Louis is doing a good job to flatten that curve. So if you need anything, if there's any information needed, Prepare STL is a good start. There's resources on coronastl.com. I think that takes you to the link of the county health department, the regional response task force, and the work that the hospitals are doing, not only for community members, but for the frontline workers, the nurses, the environmental staff, the people that need to be there and on the front lines fighting this pandemic. All the resources are there for them and our community members. This is serious. We've seen the health disparities that exist and lie within. I was pushing it on my Facebook about 2 months ago. I said, if this hits our community, specifically St. Louis hard, we're going to see huge racial lines in the data. And so we must continue to communicate, advocate, and do what we can to help our communities. Racial issues are an inherent part of healthcare because of the way medicine was built, the way that system is built, but then also the implicit bias and racism that exists. And so we must continue to raise awareness on that issue, and we must continue to advocate and get our communities resources. And so please, please, please abide by the orders to stay home. Only go out if you need to. And people who are immunocompromised or living with a chronic illness, please barricade yourself in a closet. Please, we hope to save as many lives as possible, and we want to do everything we can. So I had to get that out. I know I only have a limited time.
No, that's
that was
great.
Important for me to say.
I was gonna give you the run, so I didn't even need to. We're in sync right now, folks. Stay home. Stay home. If you need to go out, I know there are folks who are working out there who are first responders. They have to be there. And you can help them if you're staying home more because they don't have to interact with you and get sick. So stay home as much as you possibly can. And that's how you can serve your country right now. So, this was great. Thank you. Thank you for coming. We're going to put the links to all that stuff up there. We'll have you back because you're so active and you're doing so many things. And this is such an important topic. So we'll be sure to do that. But I really appreciate you being here and taking the time. Thank you.
No, thank you. I had to be the first contestant for Furry Friends. I haven't had a haircut in quite some time.
Well, that's good. No, this is great. Well, hold up. If you've got some time, Emily is still here. I can see her in the background on my screen. Do you want to stick around and do some live analysis of the Furry Friend Friday Championship?
No, I'm definitely going to stick around. I think the Possums are going to win it.
Oh, wow.
However, I do think I'm a great candidate. You got to get my mug on the Elad for Attorney General website. The Facebook. I got to go up.
Wow, that sounds pretty. You know what? I'll take that endorsement any day, even if it's just from your beard. All right, let's bring Emily in. Let's see if I can do this. Hold up. Here we go. Okay, all three of us are on the screen right now in different angles, and we're trying this live. We're trying new things. All right, so you all can still see my screen, correct?
I can.
Great. Okay, so here's what we're going to do. I am going to take us over to the bracket, and let's see if I can get this thing up there. All right, that's a Skype test. Oh, there we go. I didn't want to show that. All right, here we go. Let's show this instead. All right. So here's the bracket where we currently are at. We are starting to run low on time. There's only 10 hours left in this competition. I'm actually going to reload this page because the voting totals might have changed over time, and hopefully the images will come up for us too. That would be great. That way you can see. Yeah, there we go. Perfect. All right. So in our first round matchup, we have 16 different competitors. And, no, we shouldn't have 16. Yeah, just 8. Okay, I didn't put up all that many. All right, here we go. So we've got 8 competitors. We're already in the Elite 8. We're going to the Final 4 and then the Championship. And in our first round right here, we've got Lou Brock and Stanley are in the first matchup. And I'm going to blow up their photos a little bit. There's Lou. Okay, and then here we've got Stanley. And I'll show you the results right now. And it looks like Lou and Stanley are neck and neck with Stanley up by 2 right now. So I'm going to ask, as we've got all of you on here, what do you think about this matchup?
I think it's a matchup of great relevance for St. Louis right now. You got Lou Brock, and then you got Stanley.
Yeah.
I'll take the more relevant one at the moment. Our NHL season was delayed and if not canceled, it's canceled, right? So we're still champions. So my vote goes to Stanley, and we're gonna keep the Stanley Cup as long as possible. So yeah, Stanley, go ahead. You get my vote.
Emily, who you got in this matchup?
I love your analysis on how you just voted. That was great. This is a hard one. They're both stinking adorable. I'm gonna have to go with Stanley.
Yeah, you've got Stanley going. Wow. All right, here we go. We got 2 Stanleys out here. All right, let's go to the next matchup. So hopefully people can see that. All right, we've got Kenya versus Lucky. This one is, I'll blow up Kenya real quick. There's Kenya, a friend of the campaign. All right, and we've got Lucky. Oh, wanted to blow it up, but now you'll see the results anyway. There's Lucky. This is a Springfield battle. Right now, Kenya's up 22-16, so it's still anybody's game, but Kenya is starting to pull away. Thoughts on this matchup and who you're expecting to emerge?
I'm a sucker for some senior dogs.
Yeah.
The salt and pepper, I'm going to have to, Lucky's Lucky's adorable too.
Yeah,
I mean, come on, look at that face.
Yeah.
But I think I'm gonna have to go with Kenya.
Kenya, yeah. Mm-hmm. Michael, what you got on this one?
Kenya is adorable, but I like to go with the underdog. How can you not love that smile? Lucky smile.
Smile, yeah.
That is an adorable smile.
It's a good smile, and I'm actually expecting more from Lucky. Well, it looks like it's updating live right now. It appears that they're going against whatever it is. But yeah, I was expecting more from Lucky. Lucky, Crystal Quaid, who's the minority leader in the House, submitted Lucky, and I just thought there would be more support behind that would come with that. But perhaps another day, or there's still time. There's still 10 hours left in this competition. All right, here we go. We're going to go to the second to last matchup. This is a double matchup on the one end, 2-on-1. This is Tiberius and Flynn. They've both come in a combo here, and apparently, I just noticed this now, but Flynn apparently loves to use scissors. Maybe he's home making some masks over there, which is great. Trooper is their opponent. Trooper has quite the Facebook following. I haven't checked these results for a while, and the results are, wow, Tiberius and Flynn are pulling away with this one. 27-12 is the score. Does that surprise any of you at all?
That does not surprise me. If you are a true quarantine person right now, you've probably seen Don't F with Cats. And you do not mess with cats.
Yeah. Now you got two. It's not just one here, so you got double trouble. Emily, your thoughts on this matchup? You think the Cats are going to pull this one away?
I mean, you don't mess with cats, and especially a cat who likes to play with scissors.
Yeah, I think that really sold. I did not see that before. Now I think I understand the draw here. So,
yeah.
Flynn looks serious. So I don't know if we're going to mess with that. All right, and then our final matchup here is Wiley. And I'm sorry to the owners. I apologize. It should not have been a space here. This is supposed to be one word. But there's Wiley. Wiley has quite the story. He rescued himself, actually. Wait, hold up. That might not be on the screen for everybody to see. Make sure. Okay, there we go. Now we're back here. We're back to Wiley. Wiley rescued himself, just ran into the car, and now he's got wonderful owners. And Barney, who was just rescued during the coronavirus crisis, actually. And so if you all are interested, please check out your local animal shelter and see how you can foster, adopt, or help out, because it's an important time. So that's the matchup we've got here. I'll show you the results right now. And wow, Wiley with 51 votes to Barney's 10. That could be insurmountable. Let's go to our live analysis. Your thoughts?
Wow.
Yes.
I'm speechless at the gap. I wasn't gonna expect. I couldn't expect that. Wiley's adorable. I love to hear a strong self-advocacy story.
Right. Who doesn't?
So you gotta love Barney's story as well. Rescue. You can foster pets right now. This is a great time. If you are bored at home, you want to get a pup or a dog, a cat, whatever the case may be, it's a great time to do that. My girlfriend would kill me if I didn't even mention that. She works for Purina. She does all the digital content for them. So if you're getting served any Purina ads, you can blame her. It's her fault. Wiley, I love the story. I'm sorry, Barney. I don't want to give you any pity votes.
Yeah, it's too bad, Barney.
There's still time. Go vote.
There's still time to vote. There's still time. The polls have not yet closed. We still have 10 hours remaining here, and there's a little less than 10 now. Emily, your thoughts on this matchup?
Now I'm going to piggyback on that. What you were saying, yes, there are so many shelters out there right now that you can go adopt, rescue. You can foster, of course. Fostering is a great tool. Go out there right now. There's so many animals, and it's not just cats and dogs too. There are millions of different animals out there that you can go foster at this moment. So I love, that puppy. Super adorbs. I look at the face.
Yeah.
I love the story of, you're going to rescue me no matter what. But I also love a good coronavirus pandemic
Right? I mean, and
story.
it's very timely.
So I'm going to have to go with Barney.
Yeah. Wow. Okay. Well, there you go. We got Barney.
Barney.
Barney just got a vote. Maybe it was a pity vote. I don't know. But I will say this. Look. Barney is a cherished member of our team. His owner Daniel. He's our volunteer manager for the campaign. So for those of you who are getting messages about how you can help Missouri right now, that's him. That's him with his dog. Wiley. Also owned by wonderful folks over in Cass County. And I'm going to tell you what, they put up a song, and we'll be putting it up on our Facebook page soon. But they literally made a song for this competition and for Wiley's. I think that's fantastic. Oh, look, we've got another furry friend. See, look, Michael, like you can submit your furry friend too. It doesn't have to be your beard. It can be an actual furry friend.
Yeah, that's the next thing coming. So okay, Oscar great. And Zoe at Oscar Loves Zoe on IG. They will be submitted next Friday.
Oh, that's great. Awesome. We'll have them. We'll put the Instagram handle up there. We'll get them the followers. All right, folks, I really appreciate all the time you took, the wonderful analysis that you gave on the spot. I think this was a great show. For all of you who were watching with all of us, thank you so much for being here. Leave your comments in there. We'll get answers to your questions. If you'd like to submit a furry friend, you should. You certainly should. And if you'd like to vote, we'll put the link down there too. But everybody have a wonderful and safe weekend. Stay safe out there. This will be up on the podcast early this week for those of you who are listening. And we'll have some more wonderful guests. Thank you both so much to Emily, to Michael, to all of your furry friends, and all of the ones to come. We wish you all the best. Thank you.
Thank you.
Thank you. Bye.
Yeah.